How best to expand access to health care for lower-income Floridians has been and remains a serious issue for the Florida legislature, especially in light of provisions of the Federal Affordable Care Act. Our Bishops' Conference is guided by the premise that each human life is sacred and possesses innate worth, and that health care is essential to promoting and protecting the inherent dignity of every individual. So improving access to care for vulnerable populations has long been a public policy priority for the Florida Conference of Catholic Bishops and the Bishops of the United States. The debate here began with a focus on whether or not to expand Medicaid under provisions of the Federal Affordable Care Act to persons with incomes to 138% of the poverty level, which is just over $15,000 for an individual or just over $26,000 for a family of 3 in 2012. For the first 3 years, the federal government would pay the full cost of such an expansion. In the out years, that would taper down to 90%, with the remainder provided by the state. Our Bishops' Conference went on record supporting the expansion envisioned under the Affordable Care Act. Our letter to key leaders is available on our website. Governor Scott, for all his concerns about the overall law, expressed early support for Medicaid expansion, recognizing the benefit of extending care, indeed potentially life-saving care, to otherwise at-risk Floridians. There was also early support for the concept in the Senate, but the House rejected the possibility and the Senate joined in taking a position against expansion. However, at this point in the session, the discussion over how to extend affordable health care to Florida's economically poor and working families continues, and apparently all options, including the use of federal funds, limited federal funds, and using no federal funds, are all on the table. In our view, the matching funds make any effort much more robust than those that do not draw on federal funding. We will continue to engage this important issue as the session continues. Happy Easter, and may the Lord prosper the work of our hands.